Hello, everyone, and welcome to today's Vigor Wellness webinar from Friends Life Care, your thyroid, your health. Before we get started with today's very interesting presentation, I'd like to do a few housekeeping slides. My name is Gail Tamarchio, and I'm Friends Life Care Initiative. And I just want to show you a few things just so you can get the most out of today's webinar. So on this screen, this is an example of what you should be seeing on your screen right now. And so you're listening in on your computer or tablet speaker system by default. If you would prefer to join over the phone, just click telephone in the audio panel, and the dial-in information will be displayed. You see the orange arrows next to this area of the interface. Also, if you have any questions that you would like to ask during today's presentation, you can just type them into the question box, and I will relay them to Annmarie for you, and she will answer them either during the presentation or at the end, just depending on when she can do that. We just ask that any questions that you ask be of general interest and not personal questions that just relate to one or two people. All right, so if you have any questions, just dial them in just type them in the box for us. Also, you'll see the handout button on the right side. It says there's two handouts. So if you click on that handout tab, you'll see the two handouts. You can click on those, open them up, and follow along with the presentation, or print them out and use them later. Okay, but you do not actually need them during the presentation. You can download them at any time. So now I'd like to introduce our presenter, physical therapist and functional medicine physician assistant, Annmarie McManus. Annmarie treats all types of chronic illnesses and has several areas of specialization. She has completed postgraduate training through the Institute for Functional Medicine Certified Practitioner Program. She's highly skilled at treating the root causes, not the symptoms, but the root causes of hormonal imbalance through addressing adrenal, gastrointestinal, and whole person health. She utilizes bioidentical hormone replacement therapy for people of all ages. And in addition to her training and over 20 years of experience as a physical therapist, she incorporates a functional medicine holistic approach to neurological and musculoskeletal concerns, including chronic pain and fibromyalgia. Annmarie's passion is providing holistic care while utilizing an individual approach to support her clients' physiological, emotional, and nutritional needs. So I know there's a lot of interest in today's presentation. Annmarie, thank you so much for joining us, and we're really looking forward to hearing what you have to say.
Thank you. Gail, can you hear me? Great. If you want to switch over to my slides so I can start the presentation.
Doing that now.
Great, thank you.
Sorry for the technical glitch. Okay.
No, we're good. We're good. Good morning, everyone. Again, my name is Annmarie McManus, and I'm a functional medicine physician assistant at Philadelphia Integrative Medicine. Thank you, Gail, for inviting me this morning. I am really pleased to present the topic, Your Thyroid, Your Health, to Friends Life Care. Just as well, feel free to send in the questions as the presentation moves along. Hopefully, most of your questions will be answered during the presentation. If not, we'll have a little short question and answer section near the end. And Gail, I know you'll be monitoring all of our questions coming in.
Absolutely.
So thank you. So for today's presentation, this is kind of what our objectives are. I just wanted to kind of discuss what the thyroid's function is, a little bit of some anatomy and some physiology, just some basic information about the thyroid. Symptoms of thyroid dysfunction. We're going to discuss some common root causes of thyroid dysfunction, how a provider would look at assessing if you have a problem with your thyroid, and then looking at things like your nutritional support for both the thyroid and some of your other hormones that coexist with the thyroid gland. And then lastly, we'll just look at some lifestyle, some supplements, and medications that are used to treat thyroid problems. So firstly, the thyroid gland is what we call one of the master glands of the body. It produces hormones that affect every organ system in the whole body. It is a butterfly-shaped gland, and it's located just in front of the neck, just above the trachea. What the thyroid does is it produces two hormones. One is called thyroxine, which sometimes you'll also hear as T4, and the other one is triiodothyronine, which is also known as T3. These hormones affect every tissue in the body. They influence growth and development in utero, dental and bone development, brain function, and overall metabolism and body temperature. Our body's just a bunch of reactions, and for reactions to occur, they have to occur at a certain temperature. So we all remember our high school science class that our little reactions, if we weren't at that exact temperature, didn't occur. Well, that's what happens in the body. And the thyroid's the main gland to control this temperature regulation. So it's really important that if we don't have a functioning thyroid, all these little reactions in our body just don't occur, and then we start having dysfunction in the rest of the organ systems. Approximately 15 to 20% of all adults in the U.S. suffer from some sort of thyroid dysfunction, and this includes both diagnosed individuals and many undiagnosed individuals. So this slide's got a lot of information on it. We'll actually look at the slide twice, so if you kind of miss it, we'll come back to it a little bit in a few slides. So there's many factors that affect the function of the thyroid. Number one is proper nutrition. It's really critical that we have proper nutrition for the production of both these two hormones, T4 and T3. And then proper nutrition and these, you can see some of the nutrients listed, is really important to convert T4 to its active form, T3. So T3 is what works on the cells in the body. And so if we don't have these nutritional compounds, we don't get this conversion to this active form. Another factor that can affect thyroid function is toxins. Toxins can be detrimentally affect the thyroid function. And this includes both environmental toxins as well as some medications can also impact thyroid function. Comorbidities can affect thyroid function, especially high inflammatory states such as illnesses and infections. Also included in comorbidities is autoimmune conditions, food allergies, and food sensitivities. As well, our lifestyle affects thyroid function. How much sleep we get, how much exercise we do, chronic stress in our life, and also our relationships with those around us can affect thyroid function. Now, just sort of a highlight on this picture here. So we have the thyroid gland, which produces the T4, and then the T4 is converted over to T3. However, sometimes we have this conversion over to reverse T3. Reverse T3 is kind of like the brake. This is an inactive form of T3. So we don't really want a lot of this reverse T3, and we'll sort of go through that later on why this tends to occur. So you can see both of these hormones present. So just an oversimplification of kind of what the thyroid, how the thyroid works. The pituitary gland is a small gland inside the brain, and it's the switch to turn on the thyroid. The pituitary gland secretes a hormone called thyroid stimulating hormone. So it stimulates the hormone, or stimulates the thyroid gland to make its hormones. The thyroid gland then secretes those two active hormones, T4 and a little bit of T3. So a majority of it is T4, and then a little bit is secreted as T3. However, then the T4 has to be converted into its active form, known as T3, in the liver, in the kidney. Some of it also, this conversion occurs in the gut and the peripheral tissues of the body. It's important to note that 20% of this T4 is converted in the gut, and so the relationship between your gut function and your thyroid is quite significant. So this is what everybody wants to know, is signs and symptoms of thyroid problems. Now, due to time constraints, I'm really going to kind of discuss the symptoms of an underactive thyroid, or also known as a hypothyroid, which is the majority of what people tend to be concerned with and kind of complain of symptoms of. There is a condition called hyperthyroidism, which the thyroid gland produces too much hormone. Sometimes this is also known as Graves' disease. However, this just affects less than 1% of the population, so it's not as popular or as known about. So we'll kind of not address those issues for today because there's so much in hypothyroidism that we want to discuss. So some of the signs and symptoms are quite a few of them. People tend to say, oh, my thyroid's not working because I'm tired and I'm gaining weight. Well, unfortunately, there's other factors that can cause these symptoms, but thyroids do impact how we feel and what our weight is. The fatigue with thyroid conditions is quite persistent. patients don't complain. They complain that in the morning they're tired, but it just never gets better during the day. Whereas some of us, we're a little tired, fluctuates throughout the day. That's not typically a thyroid problem. Thyroid fatigue is quite persistent. The weight gain can be slow or it can be sudden onset. Low thyroid symptoms can also be their sensitivity to cold and then cold intolerant. We also can see changes with our cholesterol panel, and especially changes in elevations in what we call the low-density lipoprotein. And this increases our risk of both atherosclerosis and heart attack, and increases some of our inflammatory markers in our bodies. So we definitely want to make sure that we are addressing thyroid because it is related to heart function. As well, the thyroid is related to both high blood pressure and stiffening of the artery walls. And then it also can impact the heart and how the heart beats and stuff. And so sometimes we say that people have an underactive thyroid is that they have a slowed heart rate. Also, along with the cardiovascular symptoms, is that they have low blood sugar, and they tend to kind of get what we call hypoglycemia events. But this is also related as well to diet. Other symptoms of underactive thyroid in the endocrine area is both men and women can have a loss of libido. There can be menstrual abnormalities and fertility issues in women. We also can notice an enlarged thyroid. Sometimes this enlarged thyroid is known as a goiter, and this can be due to autoimmune inflammatory conditions or even iodine deficiency. And this was seen early in the 1900s where there was goiters, iodine deficient clients who had goiters. With our hair, skin, and nails, quite hallmark about thyroid is that clients complain that their hair is dry, coarse, and brittle. Their skin may be rough, dry, and scaly. Elbows maybe have this really thickened skin we call keratosis. The palms of the hands have become quite calloused, and not just in the areas that you would typically see callus. It happens throughout the whole palmar area, and this is called keratoderma. The nails, though, however, become very thin and brittle. They can break very easily. Underactive thyroid clients also complain that they bruise really easily. And then one of the other signs of an underactive thyroid, and this is usually quite after it's been a problem after a while, is that there's loss of the outer third portion of the eyebrows. It just gets very, very thinned. Other complaints that sometimes go with thyroid is that the client feels very slow. Their brain feels slow, their heart feels slow, their mood is slow. Depression is very, very common. In fact, there are some studies out there that say that 10 to 15% of all depression is actually a thyroid dysfunction. And the type of depression is just kind of this, melancholy, this sort of blues that clients tend to complain of. There's difficulty concentrating, forgetfulness, and sometimes what we sort of call the brain fog. Just can't kind of clear our brains and get a clear thought. With our joints and muscles and stuff, there tends to be some muscle pain and weakness, especially in the calves, the thighs, and the arms, and joints tend to be a little stiff, especially worse in the morning. Digestive complaints. Often we hear about chronic constipation, and this is both infrequent bowel movements as well as hard stools. Clients who have underactive thyroids tend to have an increased risk for both gut infections. They have an increased risk of developing food intolerances and low stomach acid. When it comes to detoxification, if you have a sluggish and congested liver and gallbladder, you can't detoxify toxins. And if you can't detoxify toxins, then that can also impact the thyroid. Remember how we talked about before that T4 is converted to its active form, T3, in the liver and the kidney. So if they aren't working, if the liver's not working well, it kind of is a cyclical approach. And other symptoms of an underactive thyroid, people tend to be, their immune systems are affected, their increased susceptibility to colds, they have delayed wound healing. Sometimes there's some complaint of a morning headache. Anemia can be common, and both anemia can make thyroids worse, and thyroids can also impact anemia, and this is usually due to underlying nutritional deficiencies in both iron and B12. And then tinnitus is sort of a more of a rare symptom, but it can occur, and this is also known as ringing in the ears. So sometimes this is sort of just a general description of what a thyroid client would look like. Now this is having quite a few symptoms. So you see that the hair is very dry and coarse. And sometimes when you pull on the hair, we call it a tug test, the hair just comes out by the root very, very easily. Women sometimes complain that their ponytails are getting a little bit thinner, and so it's just this sparse hair loss. We discussed the lateral third of the eyebrows tend to thin out. There's swelling, especially underneath the eyes, but we can also see the face being very puffy, and there can also be swelling noticed in the face, the legs, the feet, and even the hands are also noted. The tongue and the mouth are really important areas for a functional medicine provider to look at. We look at the tongue, and with patients who have underactive thyroids, they tend to get the scalloping of the edges of their tongue. The tongue kind of flattens down, so the edges of their teeth kind of make these little scalloping edges when their thyroid's not working properly. The tongue and the mouth can also tell us as well about cofactors that make the thyroid work, especially looking at iron and B12 deficiency, which we need for thyroid function. And again, we discussed about the nails. The nails tend to break very easily. They're very dry and brittle, and they can have these ridges that kind of occur across them. The nails can also tell us as well some other interesting things about nutritional deficiencies as well. So kind of going through common causes of hypothyroidism. There's a lot of them. So one of the key areas is nutritional deficiencies. The thyroid needs a lot of nutrients to function properly. And unfortunately, we have the standard American diet, which we do not have a very nutritionally dense diet. So some key nutrients are sometimes often lacking. And a couple of the areas, I'm just going to touch on a few of them that are really important. Selenium is a really critical nutrient. And one of the reasons why is a lot of our fruits and vegetables are not grown in these soils anymore that are not nutrient dense. Selenium is very common because of topsoil erosion, especially on the eastern seaboard here, that we have very selenium deficient soil. So our fruits and vegetables don't get a high level of selenium. Now, a synergistic nutrient to selenium is zinc. These two tend to work together, and zinc is a really critical cofactor for the thyroid hormones to work on the thyroid receptors in all the tissues. So zinc is often a deficient hormone deficient nutrient that we often look at. As well, iron is critical. Iron is needed for the production of T4, and its synergistic nutrient is iodine. And again, iodine tends to be because of soil erosion, and we tend to have quite deficient iodine lacking vegetables and fruit. So a long time ago, the government decided, because we had this iodine deficient soil, that they decided to iodinize salts, and that's where we got our iodine from. However, we've seen over the past 30 years that we don't tend to have a lot of high salt diets, and so we don't tend to always get iodinized salt. And then clients are always also looking towards other salt substitutes, which like the sea salt, which may not have iodine in them. But iodine is something I just wanted to kind of touch base on. We don't always supplement iodine. We really want to look at it closely. It's a Goldilocks nutrient. You know, too little iodine, you can have an underactive thyroid, and too much iodine, you can have an underactive thyroid. And also, if you have too much iodine, you can also get autoimmune response to the thyroid. So it's very specific how much iodine that the thyroid wants, and we don't want to over supplementate or make sure we're checking that someone's not under their required amount per day. And then the other two hormones that are really important, or sorry, vitamins that are really important, are vitamin A and D. These are fat-soluble vitamins, and vitamin D especially, we really can't get a lot from our food sources. It is from the sun. So sometimes we are deficient in vitamin D because we're quite indoor people these days. Another common cause of hypothyroidism is autoimmunity. Hashimoto's, also known as autoimmune thyroiditis, is just basically an inflammation of the thyroid due to an autoimmune condition. And just to kind of go over autoimmunity, what the body does is when the body is exposed to a toxin or a foreign substance, it induces an immune response, and the body produces these antibodies, and these are kind of like memory cells. So these antibodies are proteins which protect against future exposure to something foreign. However, in an autoimmune condition, these antibodies that are supposed to protect us they kind of go on attack, and they attack our own cells. And they can attack the thyroid and the thyroid receptor sites. So this causes both the thyroid to decrease production of its hormones, as well as the ability for these hormones to interact with the tissues that it's supposed to be sending messages to. Another common cause of hypothyroidism is when the hormones can go out of balance. This is especially noted postpartum, as there's a big swing in the female hormones, both estrogen and progesterone. And this can really throw the thyroid off and make it quite inflamed. As well as the other hormones can also be insulin, when someone becomes insulin resistant, or if you hear the term someone's becoming a little pre-diabetic, this can impact the thyroid. And then there's also a condition that women have, it's called polycystic ovarian syndrome, and this is some of the female hormones that are not in proper amounts, and this can throw as well the thyroid off. Stress. This is a big problem with thyroid dysfunction, and this can be both transient and permanent. So our adrenal glands are these two little glands sit above our kidneys, and there are stress glands, and they produce cortisol, which is our fight and flight hormone. So this is a normal response when we're exposed to a stress. This hormone releases cortisol, and then the cortisol impacts the thyroid, and it gets the thyroid to ramp up a little bit and say, hey, let's get the body ready for this acute response. However, not a lot of us are in acute stress. We're in this kind of day-to-day chronic stress. And so when in chronic stress, this cortisol keeps being produced, and then it starts impacting the brain and the pituitary gland. And the pituitary gland then really decreases the amount of thyroid-stimulating hormone it releases, which means when the thyroid gland doesn't produce the same amount of hormone, and the cortisol also impacts the conversion of T4 over to this active form of T3. And in fact, in chronic stress, what it tends to do is it tends to put the brake on the active form of T3, and you get a lot more of this reverse T3, which is the inactive form. So chronic stress is kind of making that active thyroid underactive. In chronic stress, we sort of look at things that cause chronic stress, and we just have to look at our lifestyles, our work environment, our diet, our sleep habits. Other chronic stressors are chronic infections. So example would be like Epstein-Barr virus, cytomegalovirus, Lyme disease. These are chronic stressors on the body. Other chronic stressors on the body are high inflammatory conditions. An example would be like diabetes or even cancer. Autoimmune conditions, like we've already discussed, but other autoimmune conditions can create inflammation as well, which impact the thyroid. And these include also celiac disease and rheumatoid arthritis. Environmental toxins can impact the thyroid. So environmental toxins can be things like mold and mycotoxins. They can also be things like pesticides, and we all hear about glycophosphates and Roundup and how that's getting on our food. This has a big impact on both the gut function and the thyroid function. Environmental toxins also could be heavy metals, such as things like lead, mercury, think about mercury in our fillings, as well as halides, which would be fluoride and bromide. And these, fluorinated water does impact the thyroid, as fluoride and bromide both knock off the iodine off its receptor and tend to sit in that spot, which is critical for thyroid function. Other environmental toxins could be things like PCB and bisphenol A and stuff, which is also seen in plastics. As well as medications can cause problems with the thyroid function. There's heart medications such as amiodarone and beta blockers, hormone replacement therapy such as oral birth control pills and even estrogen replacements. There's mood medications and seizure medications. An example would be like lithium and dilantin. And there's also a couple of medications like theophylline, and even chemotherapy can even affect the thyroid function. All right, so heading over to our next slide. Just give me a moment to take just a moment's break. And I see we have some questions about which foods are high in zinc, selenium, iodine, and iron, and I will address that in just a few moments, because I know everyone always wants to know what's the important things to eat to help their thyroid. So just kind of looking at the thyroid, the assessment and testing. And this is what a provider would do when they want to look at the thyroid. When you're looking at a functional medicine approach, you don't just want to look at what the brain is telling the thyroid. You want to look at the whole picture. You want to look at the thyroid, what the thyroid hormones are doing, what are the nutritional components, how is stress impacting the thyroid, looking at the gut function, because remember that's where a lot of the thyroid hormone is also converted to its active form. So there's a lot of testing that can be done with the thyroid. So typically at LabCorp Quest, we can do some of these basic blood markers, such as the thyroid stimulating hormone, looking at the free T4, free T3, looking at that reverse T3, where we said that's that stress marker, that's that brake that would slow that thyroid down. And looking at a total T3, this is kind of important when we're looking at some ratio numbers to see if someone has maybe a little resistant thyroid, which may not be implicated as looking at some of the basic labs. We're looking at thyroid antibodies to see if there's any autoimmune problems, such as we discussed that Hashimoto's. Urinary, looking at the iodine level. As I said, the iodine, remember, we want that little Goldilocks, not too little, not too much, just the right amount. So we look at a urine iodine level in the morning to make sure that you are getting a proper amount of iodine in your diet. Looking at a CBC, and this is looking for things like anemia, which can affect thyroid function. The complete metabolic panel is looking at things like your diabetes markers and your sugar. Looking at the kidney function and liver. Remember we discussed about the liver is very important for converting the thyroid from the T4 over to the active T3. On blood tests, we can also look at iron and ferritin, which is the stored form of iron. Looking at your zinc and selenium levels. Looking at vitamin D. And then also looking at some of those stress markers we discussed, such as your DHEA and a morning cortisol. And that can kind of tell us is the thyroid being impacted by some of our chronic stressors. The micronutrient test is a fun test I love to do. It's difficult sometimes to measure these nutrients in the blood. And I always sort of give people the example of the blood is kind of like what's in our gas tank. We want to know what's in the engine itself. And so the micronutrient test is we take one of the white blood cells. It is a blood test, but we take the white blood cells and we're looking at the lymphocytes. And these lymphocytes have been hanging around our body for 6 to 8 months, and we're looking at an intercellular response and testing your key nutrients. So it actually measures really what's in our body and what's really functioning intracellularly as opposed to what's just floating around in the bloodstream. So it's a really cool test to see, you know, our nutritional status and if we are getting proper nutrients in our diet, or do we have a gut dysfunction, we're not absorbing the nutrients even though we're eating very healthy. And this kind of leads to the stool study. We really want to look at our gut and see, do we have this chronic inflammation? Do we have infections in our gut that we need to treat? Do we have this intestinal permeability or the breakdown of the gut lining? And so this is our immune system barrier, and this is what prevents foreigners from crossing into our body. And if we have increased intestinal permeability, we also increase our risk of that autoimmunity throughout our whole body. And then, as we discussed, autoimmunity can occur with thyroid dysfunction. And also through stool studies, we can look at that 20% of our thyroid, is it being converted from T4 over to T3? And does insurance, someone just asked, does the insurance cover these tests? You know, it really does depend a lot on your insurance. You need diagnostic codes and stuff, and that's something to sit down with your provider, and feel free to look on the Philadelphia Integrative Medicine website. If you go to our new patients, we do have a listing of diagnostic codes which are covered by your insurance. So you can always use that to discuss with your insurance company, will they cover these tests? Majority of the time, the blood tests from LabCorp and Quest are covered. It depends obviously on your copay. Some of the more specialized tests, the micronutrient and stool study, depends on your provider. Here in our practice, usually there is a upfront cost to the test, and then those companies then bill your insurance directly, and there's no other costs additionally to you. So if you have a higher deductible, those tests actually sometimes are not that expensive, but it really does depend on your co-insurance, your out-of-network deductible. So, and obviously the diagnosis code. So feel free to check out our website. It's philly-im.com and look at our new patient section, and you can look at some of the diagnosis codes to discuss your insurance company if they cover it. And we also have a listing as well of other lab work that we do here in our office, so feel free to take a look through that. Hopefully that answers some questions. So this was just sort of, I just want to throw up this slide here. This is the micronutrient test. I know it's kind of hard to see all the little details on it, but I'll sort of point out. So you see B12 here, you see this little red dot called B12. It's in a deficient level. So black means a borderline, and then these little green squares means you're getting enough in your diet. So B12, we said, is one of the B vitamins, and it's critical for whole body function and detoxification. So this would be an area of focus on different alternative ways of diet and supplementation to help an individual get these nutrients back into their body. So this is just an example. I just wanted to show you what it looks like. So we're coming back to that thyroid picture again, and kind of going through a little more in detail and stuff. So as we said, there's a lot of things that affect the thyroid functions, and we've kind of already discussed those nutrients. The key nutrients thyroid needs are iron, iodine, tyrosine, which is an amino acid, zinc, selenium, vitamins E, B2, B3, B6, vitamin C, D, and even vitamin A as well is really important. Factors also that the good stuff here, the factors increase that conversion of T4 to T3. The nutrients that are really important are selenium and zinc. And then we discussed the things that we don't want to occur, which is conversion, that T4 to that reverse T3, that break. That means that cell cannot respond to any of the hormone. And as we discussed, stress, trauma, low-calorie diets is an important area to discuss. We have women and men as well who've kind of done this become chronic low-calorie dieters. Well, this long-term can affect thyroid function. And as we discussed, inflammation, things like diabetes, metabolic syndrome can impact thyroid function. Toxins, as we briefly brought up, molds are common. Infections, if you have liver, kidney dysfunction, and medications as well. And over on the right-hand side of the slide, the factors that inhibit that production of the thyroid hormones, stress, are infections, trauma, radiation, medications. And then we said the fluoride and the bromide, they can block that iodine. And then toxins in our environment. And autoimmune diseases. And once you have one autoimmune disease, you have an increased risk of having a second and even third autoimmune disease. So if you have celiac, you are at a high risk of also potentially becoming autoimmune with your thyroid too. And then the good stuff on the very bottom, things that help the cells in our bodies respond to these thyroid hormones. Vitamin A is important. Exercise, especially aerobic exercise, is shown to help the sensitivity of the cells. And here we come back to zinc again, and I'll come through sort of where you get these foods from. So here we start getting into the nutritional support for the thyroid. It's really important that we, look at trying to get organic foods rich in trace minerals. And the reason why we kind of are encouraging the organic foods is there tends to be better farming practices. They're fallowing the soil, they're letting the nutrients build up in the soil. There's less use of pesticides, which we said can be toxins and impact the thyroid. Another area that we can sort of watch for thyroid is these goitrogens. So goitrogens, people always ask, aren't these supposed to be healthy foods? And these are the foods such as broccoli, bok choy, Brussels sprouts, cabbage, cauliflower, and kale. Now, you have to eat a lot of these foods for them to basically impact thyroid function. If you're eating them on a day-to-day basis, I'm not concerned. However, if you do have maybe a thyroid condition and you're a little concerned, just by cooking, steaming these foods, just shortly amounts, helps to decrease that risk of these goitrogens affecting the thyroid. However, if you also eat these foods with iodine-rich foods, you actually decrease that risk of these goitrogen foods affecting the thyroid. And then also adding sea vegetables to our clients who potentially are iodine deficient, and that we said we would look at a urinary iodine test. So sea vegetables are things like kombu, kelp and wakame, and you can find them. Bragg's sea salt has a wakame blend to it. You can sprinkle that on your foods. Kombu is often used in soups. It's really good. And you know, kelp is found around. My dad grew up on the East Coast, so I grew up with a lot of that good smelly kelp, we used to call it. Really important for thyroid function and for whole body inflammation is balancing our blood sugar. The standard American diet has way too much sugar in, and this increases inflammatory markers in the body. So balancing our blood sugar is really key for our diet. Looking at our adrenal health, and we'll go through some adrenal things that we want to do. And we looked at gut health. 20% of the healthy thyroid conversion, remember, depends on our healthy gut. So we need a healthy gut microbiome. So this is kind of like the little border that covers the top. It's like our little protective barrier. So the diet kind of we're looking at for that microbiome is eating lots of vegetables, making sure we're getting enough fiber in our diet, fermented foods such as sauerkraut, kimchi, probiotics are important, and this supports that lining of that gut. It's important that we also have proper stomach acid for breakdown to digest our foods and get some of our key nutrients. And so common medications like a proton pump inhibitor can lower that stomach acid. So we want to make sure that we're getting the proper amount of stomach acid for proper digestion. We want to eliminate any inflammatory foods, and remember, underactive thyroid can cause food imbalance, food sensitivities, but however, it also goes in reverse. Food sensitivities and allergies can impact the thyroid. So they go kind of hand in hand together. So you want to make sure if there's any foods and stuff that cause inflammation in the body and the thyroid, that we eliminate them. And then it's really important to normalize our bowel habits. The liver and the kidneys, you know, are big detox organs, and then it kind of dumps it into our bowels, and our bowels need to have this regular elimination of all of our toxins. We don't want buildup of toxins. We kind of discuss some of them environmentally that we're exposed to on a day-to-day basis. So it's really key that our body can eliminate it. So, you know, constipation is common in thyroid conditions, so we want to make sure that that regularity of the bowels is occurring. So the use of magnesium supplementation, vitamin C, just drinking water is really critical, and also fiber in our diet. I think there was a sort of a question about iodine-rich foods. And so besides sea vegetables, what other foods are iodine-rich? There's a couple other ones out there. Cranberries tend to be a little higher in iodine. Yogurt, especially grass-fed, you can find it. Navy beans are high in iodine. Organic strawberries, eggs, and then some of our smaller fish like sardines, shrimp, tuna, scallops, and salmon. But we want to make sure that we have good fishing practices so that these seafoods and fish are not exposed to high levels of toxins as well. As well, you know, we talked about nutritional support for the thyroid. You know, zinc, vitamin E, vitamin A, they all help create the thyroid. So here's your zinc-rich foods. One of my favorite ones is pumpkin seeds, especially coming up pretty soon. We'll be able to roast our own. Sesame seeds are also high in zinc. Asparagus and spinach are high in zinc, and things like beef, or you know, especially organic grass-fed beef, organic chicken, lamb, and even mushrooms are high in zinc. B2, B3, B6, and vitamin C are necessary for hormone synthesis. We can supplement these as well through our diet, or even supplementation. As we've discussed before, zinc, iron, copper, and selenium are cofactors, which we need these enzymes to break down that T4 to that active T3. And so selenium in our diet, one of the easiest ways to get selenium is actually Brazil nuts. If you eat 2 to 4 Brazil nuts a day, you're getting the perfect amount of selenium that you need for thyroid function. But other selenium-rich foods are asparagus, mushrooms, again, are grass-fed beef, cod, organ meats, chicken, salmon, sardines, shrimp, and tuna. And also some of our antioxidants, vitamin C, vitamin E, curcumin, which is turmeric, and glutathione. They support thyroid function. However, I would usually have some someone following up with a provider to kind of address if we need to go to some of these more higher antioxidants. It's usually because you have other comorbid conditions, other high inflammatory things going on in the body. And vitamin D, I'm a big proponent of vitamin D. It works. It's actually not a vitamin in the body, it's a hormone, and it works on so much of the body's systems, and it reduces inflammation throughout the whole body, and it supports that immune system, which is critical for thyroid function. So if we're not getting outside, getting our sun exposure, vitamin D is an important nutrient. There was a question that kind of came up and stuff, do I recommend a multivitamin? You know, I don't always recommend a multivitamin. I think our diet, it's really important to get these things in our diet and making sure we're absorbing it in our diet. Multivitamins tend to be a little bit of a lot of things, and I tend to think that let's just focus on the things that your body needs and is missing. So I tend to focus on, all right, if someone's not getting enough selenium, all right, let's have you maybe eat a couple of Brazil nuts a day. If you're not getting enough vitamin D, then we'll have you maybe taking some vitamin D supplementation. So multivitamin for me, I tend to find there's a lot of things in there that we don't need. And I think if you're eating a healthy diet and stuff, I don't think a multivitamin always is warranted. However, there are some people with conditions that we can use it. But there are certain things I look for in a multivitamin, especially good manufacturing processes. So support for that autoimmune thyroiditis. And how we said is that most underactive thyroids, if you have, this is when you have the autoimmunity, so the antibodies are present and they're attacking that thyroid gland and trying to shut it down. It's really prevalent. How you would get diagnosed is you would have the presence of those thyroid antibodies, and the two antibodies, just for information, is that we're looking at is called an anti-TPO or an anti-thyroid peroxidase antibody, and an anti-TG, which is an anti-thyroglobulin antibody. If those are positive, you have an autoimmune condition, and it's impacting your thyroid function. So one thing that we do with these autoimmune conditions is we're looking at, again, the whole body and a functional medicine approach. And we try and go with all autoimmune conditions is try and do a gluten-free diet. There's a lot of data behind the support for this, as well even possibly going dairy-free. And you know, as much as this sounds concerning, there's so many gluten-free, dairy-free options out there nowadays that you can have a very well-rounded diet and not feel like you're missing out on anything. Elimination diet, especially if we're thinking that there's other food sensitivities going on in the body. And it does not mean eliminating everything from your diet. It means eliminating some of the key things that we think may be causing some thyroid problems. And elimination diets, we tend to sometimes do some food sensitivity testing and allergy testing to help us give some guidance behind what foods maybe we'll eliminate. And it doesn't have to be a permanent thing. Usually we'll do a trial and then reintroduce these foods individually and see what happens to the body and how the body responds. As well is looking at detoxification support, both from a diet and potentially even supplementation, to keep helping that liver and the kidneys detox and help kind of decreasing that antigenic load on the body. And we can actually see with just doing, you know, elimination, gluten-free, dairy-free diets, we can see these antibodies drop dramatically. So we know that the thyroid's not being impacted as much as when the antibodies are really high. It's really important for autoimmune conditions to address your blood sugar and adrenal health, and that's, you know, our stress. Looking at those gut infections and treating those gut infections, and supporting that the gut microbiome, that gut integrity lining, is also really important. The thyroid, adrenal, and insulin connection. So, as Bethany Hayes, one of the presenters I love going to watch, she always says that all hormones work in concert. They dance with one another. You can't have one hormone without the other, and they all impact each other so much. And these endocrine hormones, you know, their main system is kind of like glucose metabolism, making sure the body gets enough fuel. And it's really important that your body finds this balance. So they all communicate with each other to keep, you know, our temperature and our fuel going so our cells can do what they're supposed to do. And when they're imbalanced and stuff, they do impact. And I hope I addressed, you know, kind of how gut function affects the thyroid function. Thyroid affects the adrenal glands affect the thyroid, and it kind of just keeps going round and round in a circle. So I think it's really important to look at, you know, our diets and stuff. And we really want a nutrient-dense, low glycemic diet. And so glycemic diet is, Glycemic Index is kind of how it's a marker of how quickly a food raises the blood level. So it's a scale on 0 to 100, and the higher a food is closer to 100, the quicker it raises the blood sugars, which then really taxes the body, because the body has to release insulin and other hormones to kind of lower down this blood sugar. The body likes the blood sugar to stay at kind of a stable level. It doesn't like these high and low fluctuations. So our diet, we want to look at foods that are in a lower glycemic index. Really important that we get protein in our diet. Protein at breakfast is really important for energy levels. You know, underactive thyroid people do complain about morning fatigue, so it's really important that we encourage that protein for breakfast. And then getting then protein every few hours and stuff. When you do have protein regularly, it helps to stabilize that blood sugar a little bit more. You don't get these swings, and we've all kind of done that sugar caffeinated high drink from Starbucks, and then we sort of crash afterwards. That's not healthy for the thyroid, and it tends to make the thyroid quite irritable. You know, trying to fix our standard American diet and eliminating a lot of our box, bag, canned foods and stuff, our carbohydrates and sweets. We want to avoid these foods that don't have any nutritional density, anything without, like, we don't want to have excess. Those are just sugar and all fillers. We want fiber, we want good healthy fats, and we want those proteins to keep that blood sugar level. Really important, I think, is our fruit juices and even carrot juice. Those tend to kind of spike those blood sugar levels up. And then our adrenal, there's certain things that can affect the adrenal glands. Caffeine is a big adrenal stimulant. If the adrenal gland is just irritated and pushing a lot of that cortisol, we kind of want to make sure we're looking at how much caffeine we're impacting or intaking a day. Green tea, though, is great for our adrenal glands and for our thyroid glands. There's this component called ECGC, don't ask me to say the name, it's ECGC. Anyways, it's a huge anti-inflammatory. It's great for the thyroid and great for the whole body. As I discussed, good fats are really important to have in our diet, organic meats. And then also, you know, organic vegetables. You know, I don't think we just get enough vegetables in our diet. It's so important to try and get them, if possible, at every single meal. So as we discussed, lifestyle and supplementation, exercise is important. I like to call it purposeful movement, doing something you like to do, especially aerobically, getting your heart and your lungs working. You know, finding something you enjoy doing, whether it be gardening, walking, swimming, just something getting the whole body moving. Really important to manage our stress. You know, sleep is critical. We need to get that good, deep, restorative sleep. Goal is around 7 hours. Relaxation. Are we just taking a breath during the day and just kind of, you know, kind of catching ourselves, and we're not going too much. Relationships. It's really important for a thyroid that we have healthy support relationships in our life, and that can affect the thyroid. We see that chronic stress, and relationships are part of that. You know, doing things to help our stress level, meditation, mindfulness, prayer, journaling. I think, you know, Zentangle. There's a lot of things out there that help us just to kind of just internally kind of calm our bodies down. Supplements that help, as we discussed, the micronutrient, zinc, selenium, iron, your B vitamins, vitamin D, vitamin A. Some of the adrenal gland, sometimes they can also use some supplementation too. And two very easy, safe ones that are out there are ashwagandha and schizandra. These are called adrenal adaptogens. So if your adrenal gland's overworking or underactive, these can sometimes help a little bit. And then we come back to with treating the an underactive thyroid with medications. And now these are prescribed medications by a provider, and it's based upon your lab values as well as your symptoms. You know, we never treat 100% lab. We're looking at the person and their symptoms. And so common one you tend to hear, actually, levothyroxine it's the #1 prescribed medication worldwide. Not the most expensive, but it is the #1 prescribed. You tend to hear the generic name levothyroxine. It is a synthetic T4 medication that we give to clients, but remember, your body still has to convert that T4 to T3. So there's a T3, a synthetic T3 as well. It's called Cytomel is its branded name. Liothyronine sodium is the generic name. Then you can have these blends of hormone or thyroid hormone replacement. And so one you'll hear about is common as armor thyroid or nature thyroid. These are made from pig thyroid gland, and they contain both T4 and T3, so the body doesn't have to convert as much T4 over. However, sometimes with autoimmune conditions, we sometimes kind of watch these very closely. If the body's attacking the thyroid gland, it can also attack the porcine components and stuff as well. Vegans don't tend to want to do the armor or nature thyroid. And then there's also being able to use our compounding pharmacists, and they can actually compound a synthetic slow-release thyroid hormone that contains both T4 and T3, and we can customize it. The one thing about T3, it doesn't have a very long half-life, so if you're just taking T3, it has to be done twice a day, whereas when we work with compounders, they can sustain release it so that you only have to take one pill a day. And thyroid hormones are taken first thing in the morning, before any other medications, before food. So that's kind of just sort of a key point. I just also wanted to kind of, it's not on these slides and stuff, but I was just doing some research, and it was very interesting to see there was a researcher who looked at the top 10 thyroid supplements, and these are like thyroid supplements with a kick that were sold online, and 9 out of 10 of the most popular thyroid supplements sold online contained actually T3, T4, or even both of the hormones, which is kind of a little concerning and stuff. And they actually contained these hormones at a level of almost prescription level. So I think we have to be very careful if we think we have a thyroid gland, self-medicating ourselves with a thyroid supplement, because it sounds great. So I think we do need to be careful with what some of our supplementations, and making sure we're going to reputable companies, and talking to your provider about what you're taking, and also getting regular lab work done to make sure that if you are taking supplementations, you're not causing any irritation. So kind of like an overview, I know we're kind of getting lower in time, is the thyroid gland is the master gland of the body, and the hormones that it releases, the T4 and T3, have widespread functions throughout the whole body. The symptoms, I think there's quite a comprehensive list, and as well I've sort of there's a PDF as well with the some common symptoms that if you're thinking of a thyroid problem, if you take a look through the list and stuff, if you have 4 or higher, it is something to talk to your provider about. And it's not just I'm tired and I'm gaining weight. There are other symptoms to have. I think we've addressed the root common cause of thyroid dysfunction. Very common cause is autoimmune conditions, and it is becoming more prevalent these days. Things that how to assess for thyroid dysfunction, whether it be blood tests, urine, stool tests, and specialized tests to look at our nutrition, our gut health, and our adrenal health. And then kind of looking at the nutritional support, I think it's always important to look at our diet first, and if we can't get it through our diet, then looking at nutritional support. And I think it's really important for lifestyle. We need to look at a good diet, importance of our sleep, our stress management, relaxation, and exercise is also really important. So I thank you very, very much today. Gail, thank you for inviting me, and Friends Life Care. It's been a pleasure. If you're interested in pursuing a functional medicine approach to your health, please feel free to contact our office. Our office number is 1-888-702-7974, extension 2, or feel free to check out our website at Philly, PHILLY-IM.com. And as well, we'd be happy to if you have any questions and stuff, you can also contact us at info@Philly, PHILLY-IM.com. And on behalf of Dr. Tetlow, Lauren, Rachel, who's our dietitian, and myself, we wish you good health and enjoy the rest of your day. Thank you so much.
Thank you, Annmarie. Just so you know, there are a few questions that came in that you can't see. So one of the questions was, does aging alone cause thyroid problems?
Well, as we age, we tend to get a little bit more of an underactive thyroid as we age and stuff. So yes, we do tend to see some of these symptoms. People sometimes address some of these symptoms as, oh, well, you're just getting older. But I think we also have to make sure that we are looking at the thyroid function. But we have to be careful, because if we we don't want to overstimulate someone with thyroid as we get older, because we can cause things like cardiac irritation and stuff. So it's kind of a hand in hand. Aging, you do lower your thyroid hormones, and so I think you have to look at the symptoms and then get, a functional medicine approach to what's going on. And then, am I saying that fluoride in toothpaste is harmful? We have to look at, there's not just fluoride in toothpaste, there's fluoridated water. I think toothpaste, if you're spitting it out, and not eating our toothpaste, I think that's really important. But there's there's a whole group of these halide compounds in our environment. Bromide, things are brominated, our breads are brominated, our Gatorade had brominated stuff in it, and they removed that a couple years ago, but we are getting a lot of exposure to these halides environmentally. So I think anything we can do to kind of decrease some of these environmental exposures does help our thyroid. So I think you have to look at that in context with everything else. If you're drinking high fluoridated water and fluoridated toothpaste and you're getting fluoride treatments, are you getting too much potentially, and are you having thyroid symptoms, and is that an area you need to address? So I think we have to look at the whole picture, not just taking one thing in and out of our diet. I think there's a lot of other components and environmental toxins we need to be concerned about. Prebiotics, somebody asked about prebiotics as well as probiotics. Well, prebiotics, one of the main ways we get prebiotics is from vegetables. So I think a diet high in vegetables is really important, and fiber, so that our body can make its own probiotics. But I think when you have a dysfunctional gut, we have to heal the gut first, and then look at the balance between adding in the probiotics and the prebiotics. And I think I pretty much addressed all of that then. And then, autoimmune and stuff, conditions can affect multitude of different areas, and kind of the diet and lifestyle interventions I talked about with Hashimoto's can also help other autoimmune conditions, like lichen sclerosis, rheumatoid arthritis, scleroderma, and there's a whole list of autoimmune conditions out there. So I think looking at, blood sugar balancing, a good nutritionally dense diet, stress management support, going, possibly gluten-free, dairy-free, I think with some support. We have a dietitian in our practice and stuff who does an amazing job. It's kind of overwhelming to have someone throw you just an elimination diet and feel like you can't eat anything, which is not what we want people to do. So yes, we've seen a lot of support with changing diet that can help autoimmune conditions. I think that's all the questions I've addressed.
There's another one. Would low thyroid cause heart palpitations?
Yes, it can. And high thyroid can also cause heart palpitations too. So that's why it's kind of important. And autoimmune can throw that off too. So yes, heart palpitations can occur. Yes, but heart palpitations are also related to adrenals, female hormones, especially if women are sort of going through like perimenopause. You can have heart palpitations. So I'd want to look at the whole. I wouldn't just relate it just to thyroid. I'd look at the whole body approach and what else is going on with these other synergistic hormones in the body.
And I just have one more question. I have hypothyroidism caused by non-toxic goiters that I've had since puberty. Does this information apply to me?
Of course it does. Of course. Yeah, of course it does and stuff. Goiter is just an enlarged gland. What we have to know, why is the gland enlarged? Is it because you're low in iodine? Do you have autoimmune conditions? Is it changing in size? Is there nodules appearing on the thyroid? So I think it's important to have it followed regularly so that we're not having any other further conditions. And when you have hypothyroidism, it is something that needs to be monitored closely, because you can see so many things impact the thyroid gland that if you sort of don't look at your gut health, or you don't look at, your diet and stuff, I think that can impact, and then just getting frustrated with, why isn't this hormone working, this supplement or this prescription medication not working for me? Because you need to look at the whole body and the whole picture.
Thank you so much, Annmarie. You gave us so much wonderful information today and all kind of great ideas to make our thyroid function more optimally. Really appreciate your time and Philadelphia Integrative Medicine, for also supporting this presentation. So then thank everyone for listening today. We're glad that you were able to join us. When you leave today's webinar, you will receive a short survey. It's very, very short, only 5 short answer questions, and would really appreciate your feedback just so we can kind of improve our wellness webinars in any way that you would like. You're also going to receive a follow-up email within 24 to 48 hours with a link to view this recording, so you can watch it again or share it with friends, whichever you would like to do. And you'll also see a link for our next wellness webinar, which will be held on November 1st, and it'll be on Medicare and how to choose supplemental policies. So, like I said, that's going to be November 1st from 11 a.m. to noon, and you'll see a link on that in the email that you'll be receiving with the recording. So thank you for joining us, and hope to see you again on November 1st, or hear you again on November 1st. Okay, take care.
Thank you. Bye-bye.